everyone, and thank you so much for tuning in to KBTV. I'm Dr. Karlisha Booze. For the month of May, we're focusing on Stroke Awareness Month. And today we're talking to Monica Cook. She's the Stroke Program Manager at Piedmont Macon, and she's here to talk about stroke awareness and why is it so important just to know things about stroke. So thank you so much for coming on the show, Monica.
Hey, Carly, thank you for having me.
Absolutely. So, Stroke Awareness Month, talk to us about, the importance of just spreading awareness of stroke and just some things that we need to know.
Yeah, so Carly, one thing that is very important when it comes to stroke is recognition. So I definitely want to make sure that everyone understands the signs and symptoms of stroke. With stroke, signs and symptoms, they come on very fast, very suddenly. Patients will exhibit the signs and symptoms of stroke. And there's a great acronym to help you remember the signs and symptoms. Just remember B FAST. So the B stands for balance. So any changes in a balance problem, loss of coordination, dizziness. The E is for eyes. So think vision changes or double vision. The F is for face. So facial drooping on one side, even sensation changes on one side of the face, so numbness or tingling. The A is for arms or legs, so think arms or leg weakness, and even sensation changes there. The S is for speech, so changes in speech, slurred speech, even trouble finding words. And then the T is for that terrible headache that really comes on very fast and all of a sudden very heightened in intensity, and people often just say this is the worst headache of my life. If any of the symptoms are present when it comes to stroke, even if it's just one, it's now time to call 911. So we never want you to wait to see if symptoms go away. We want you to respond and get those appropriate treatments because they are time sensitive.
Okay. Now, we often hear about, blood pressure, high blood pressure. Um, what is the relation in terms to risk of stroke when it comes to talking high blood pressure?
Right. So high blood pressure, Carly, is the number one risk factor when it comes to all types of stroke. Controlling and managing our blood pressure is the single most powerful thing that we can do to reduce our risk of stroke because over time, the blood pressure or the pressure in the vessel wall can weaken that vessel wall, making it stiff and hardened. It sets the patient up for increased risk of a blockage, which is an ischemic stroke, but also that stiff blood vessel wall from the long-term high blood pressure can actually bust, which is a hemorrhagic stroke. But controlling our blood pressure is the most important thing that we can do to reduce our risk of stroke.
Okay. Now I know you mentioned about the acronym Be Fast. I mean, what are some more I would say precautions or things that you would want people to know that they just don't know about in terms to reacting fast and just knowing the dangers of stroke.
Right. I think it's important that people understand how much impact that what they do within lifestyle plays into stroke because 80% of every stroke that happens is truly preventable by risk factor modifications, such as controlling your blood pressure, knowing your blood sugar, knowing your cholesterol, don't smoke, and then knowing your weight. Having these good conversations with a healthcare professional and understanding your personal risk for stroke and what you can do to reduce your risk because 80% is preventable. I would also like to tell people that stroke can happen at any age. There's no really age guideline anymore when it comes to stroke. So we all need to know the risk factors. We all need to know the recognition and be fast. And also, time is of the essence when it comes to stroke care. The quicker someone can get to the hospital, the more options they will have to not only save their life, but save their quality of life. And Piedmont Macon wants to do that. So we want people to be fast and get to the hospital so we can help improve your quality of life.
Okay. And just to wrap things up, Monica, I do know every year Piedmont Macon has a stroke stroll that's coming up this month. Can you very quickly tell our viewers what it is and what to expect this year?
Yes, absolutely. Thank you. So the Stroke Stroll is a great time for Piedmont Macon and our stroke survivors in the community. We welcome all stroke survivors to come on May the 21st to our cafeteria at Piedmont Macon Medical. We're going to celebrate you with a victory lap. Even if you're in a wheelchair, we will have someone to help get you around the lap. It's indoors, and we just want to celebrate your survivor journey. So no matter where you're at in your journey of stroke survivor, we welcome you to come. And we are asking that stroke survivors arrive at 11:30 at Piedmont Macon Medical on May the 21st.
Nice. Well, thank you so much, Monica, for coming on the show. And we'll make sure we put all these details on carlybtv.com.